Hi, my name is Ivy Leslie. This is my informative speech on bipolar disorder. This is my visual aid. Did you know that there are 5.7 million people living in the United States who've been diagnosed with bipolar disorder? According to the National Institute for Mental Health, that accounts for 2.6% of the population above the age of 18. You probably have heard of bipolar disorder, but do you know what it is? Bipolar disorder is a mental health condition that is characterized by shifts in mood, energy, and activity level that impacts a patient's daily life. You're probably wondering why this matters to me. When I was 18, I was diagnosed with bipolar disorder via a pamphlet at a student health clinic at East Carolina University. I was given some medication and sent on my way. That's how my journey began with this disorder. By now you're probably wondering, what are the symptoms of bipolar disorder? Are there different types of bipolar disorder? And if so, what can be done to combat this and help patients maintain their way of life? Well, let me tell you. Here we have the bipolar butterfly. On one side, you see the torn, discolored side that represents depression. And on the other side, you see the beautiful, brightly colored side that represents mania. According to the Mayo Clinic, mania is characterized by talking too fast, being easily distracted, feeling elated or overconfident, having high impulsivity, and comes with a lack of need for sleep. Imagine waking up one day and feeling like you are on top of the world without a care for the consequences. Mania is the best feeling in the world, honestly, until you've been awake for several days, have emptied your bank account, and have done some pretty wild things. Just like what goes up must come down, on the other side of mania, you have depression. It comes with hostility, irritability, hopelessness, and guilt. Most people in depressive states have a really hard time performing daily activities such as bathing, eating, and taking care of themselves properly. It can last for weeks and often leads to either passive or active suicidality. So I would say it's a little more than a mood swing. Now that you understand what it feels like for an unmedicated bipolar patient, I want you to think about the two different types of bipolar disorder. According to the Treatment Advocacy Center, there are two types of bipolar disorder, and it's characterized based on what type of mania or how long the mania persists. In bipolar 1, the patient experiences mania for up to a week and often requires hospitalization. And the depressive episodes can last for a week or longer as well. And then there's bipolar 2, which is often harder to diagnose because patients still experience mania, but it's on a much smaller, milder scale. It's called hypomania. And they often spend a majority of their time in depressive states. So now that you know what it feels like and that there are different types, you're probably wondering what can be done to help a patient regain control. There are two options, but patients who take the medication will have to stay on medication for the rest of their life, even if they're feeling better and have regained a normal mood cycle. The medications are antipsychotics like Vraylar or Seroquel, or you have a mood stabilizer such as Lamictal. Oftentimes, antidepressants are not recommended for bipolar patients because they've been known to cause manic episodes and trigger things that are really unpleasant. So antidepressants are not a good option. The second option for treating bipolar disorder that goes along with medication is talk therapy. You can meet with your psychiatrist or your therapist, and you'll go through how to maintain normal social rhythms with eating, sleeping, and exercise. It helps balance you out, and you can figure out what causes your triggers that cause episodes and how to manage stress. If you or someone you know is struggling with bipolar disorder, you should consider meeting with a trained mental health professional and getting help. Because while mainstream media makes it sound like it's just a bunch of mood swings, it's so much more than that. And it can honestly be really dangerous. Not all mental illnesses are the same, and they don't always look the same. So if you are struggling, consider getting help. So while it is a chronic, lifelong illness that cannot be cured, most patients diagnosed can still lead beautiful, productive, and meaningful lives with the help of medication and therapy. I want to leave you with a quote from Carrie Fisher's autobiography, Wishful Drinking. At times, being bipolar can be an all-consuming challenge, requiring a lot of stamina and courage, and even more courage. So if you're living with an illness and functioning at all, that's something to be proud of and not ashamed of. Thank you.